Welcome, everyone. Thank you for joining us today. My name is Alyssa Tay, and I'm the Science Communications Manager at CHE, the Collaborative for Health and Environment. Please feel free to introduce yourself in the chat if you like to. I'm going to start with a few housekeeping items. This webinar is hosted by the EDC Strategies Partnership. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, a program of environmental health sciences, Commonwealth Biomonitoring Resource Center, the Health and Environment Alliance, or HEAL, and CHE. We invite you to type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button at the bottom of your screen. This webinar is being recorded and it's scheduled to last for half an hour. If you'd like to download the slides, please visit the webinar page on our website at healthandenvironment.org. We'll put that direct link into the chat. I'll now hand it over to our moderator, Janan Jensen, Executive Director of Health and Environment Alliance.
Thank you, Lisa, and hello, everybody. It's really great to be online for this EDC Strategies webinar. I'm really delighted to moderate an incredibly important issue for the EU's current chemical regulation called REACH, which is in the process of being revised. Earlier this week here in Brussels, HEAL and Chemtrust had a very exciting conference on REACH, and one of the breakout groups was on the mixture assessment factor and REACH. So it's really amazing that today we are going to look at the health effects of chemical mixtures and how they can be different from and greater from the sum of the effects of individual chemicals within the mixture. We know that exposure to multiple chemicals at low levels can be harmful, even if each individual chemical is present at a level that has been classified as safe. Risk assessment generally focuses on one chemical at a time, and this doesn't really reflect the real-life exposure that people experience or our regulatory systems. So in this EDC Strategies webinar, Dr. Christina Rudén will explain why assessing the risk of individual chemicals is not sufficient to protect health. Christina Rudén is a professor in regulatory toxicology and ecotoxicology at the Department of Environmental Science at Stockholm University in Sweden. Her research focuses on analyzing and evaluating the foundations and workings of the EU chemicals legislation. In particular, she looks at how science is used for regulatory decision-making, a very important issue and topic. She served as an expert to the Swedish government and written many reports that she's going to talk to us about, the European Commission, and the European Parliament. She's also very collaborative with a group of scientists who have recently written to the EU about the mixture assessment. So with that, I would like to welcome Christina and give her the floor. Thank you for being with us.
Thank you very much, Janan, for that kind introduction, and thank you very much for having me on this webinar tonight. I know it's lunchtime for you, but it's evening for me. So, as Janan indicated, I think the reason why I have been invited today is that I was one of the main signatories for on a letter to the commissioner and her staff before summer, where we really raised scientific concern about impacts from chemical mixtures in relation to the upcoming REACH revision. The initial letter was only signed by 22 scientists. We thought we would do it like an easy way out. But once that letter became known, many of our colleagues throughout Europe reached out and wanted to sign the letter too. So in the end, there were more than 250 European scientists signing this urge to the Commission to take mixture risks into account in the upcoming REACH revision. I was also leading an expert group for the Swedish government back in 2019, writing a report on how to better assess chemicals and cumulative exposures. This report is available in full text in English if someone is interested. But let's start to look a little bit introductory about the scale of the problem. No one knows exactly, but it has been estimated that we have over 100,000 man-made chemicals in commerce across the European Union, and the corresponding number globally is around 350,000. And these are used in various applications and means that we are exposed to these chemicals every day of our lives, and they make up unintentional mixtures in our environment and in our food and enters our bodies and the bodies of animals. Another general problem is that we usually have insufficient data on both hazards and exposures for all these chemicals. As Jenon indicated, in the regulatory system, chemicals are usually assessed one by one. So this does not reflect the real-life exposure that involves, as I indicated, hundreds or even thousands chemicals simultaneously every day of our lives. These different chemicals that we are exposed to, they originate from different sources, and they are also covered by different pieces of legislation. And there is very uncommon that you assess risks from cumulative exposure within the legislation, but there's in addition no mechanism to cover exposures across these different legislations. So they really work in regulatory silos. And this approach means that the system systematically underestimates human and environmental risks. And I'm an expert in the EU regulatory system, but as far as I know, this is the same for all other jurisdictions across the world. If someone knows of a good system that actually takes mixtures into account in a sufficiently scientific and robust way, I'm very, very interested to hear about it. Because the science is very clear. Combined exposures represent a higher risk compared to if you look at chemicals one by one. And the most common model is concentration addition, meaning that the effects add up. So this figure here is from a landmark publication from 2002. And in this experiment, they identified the no effect concentrations of 8 estrogenic compounds. So these are the bars 1 to 8 in this figure. So every single chemical by themselves did not cause any effect in this test system. But once they were mixed in these same concentrations, the effect was the black bar, the mix bar to the far right. So this is a clear example of a concentration addition effect. And this has been shown over and over and over again since 2002. This also means that if we put or make decisions on regulatory safe levels based on the bars 1 to 8, they will not be sufficiently protective when we come to a mixture. Science is also growing about the effects on actual effects on human health and wildlife and the effects on ecosystems. And when it comes to endpoints or adverse effects, they are the same, of course, as for individual chemicals. It's endocrine disruption, including cancers, metabolic disorders, reproductive disorders, and neurotoxicity, immunotoxicity, and sensitization, for instance. So in terms of effects, it's of course no difference. It's just that we have the additive effect of combined exposures. Also, just the other day, there was a new evaluation of the planetary boundary system. And again, we can see that the planetary boundary novel entities where chemicals are included is not in the safe space. And the trend is that it's moving in the wrong direction. So they're really scientific and actual real-life data that calls for concern about this to improve policy in this respect. And indeed, the need for new policy was identified, at least in Europe, quite a long time ago. So already in 2009, there was an expert report published that concluded that mixture risk assessment is not only necessary, but also feasible. The Commission responded to this in a communication 3 years later in 2012. And something has improved since this. So in Europe, we have a system for assessing cumulative effects of residue levels of pesticides for some types of endpoints. But that is really the only progress. So for the other types of chemicals and for complex exposure across legislation, nothing is yet in place. And I once asked the Commission about the slow progress, despite what they have seen and what they have written in this communication. And the response I got was that it was a little bit more complicated than we anticipated. And the fact is that we currently lack the input data that we need to do mixture risk assessment on a broader scale. So, for instance, we don't know really yet what are the relevant mixtures. So in every room where all of you are sitting, you have your mixture in that room. And when you leave your house, there will be another mixture. And what you're exposed to today might not be the same that you're exposed to tomorrow. So if we're going to risk assess mixtures, we need to know the identity and the number of chemicals and the respective concentrations in all the relevant environments. And we just don't have that information. And as I said, the mixtures will change in time and in space, so it's a continuously moving target. And considering the high number of individual chemicals in the system, the number of possible mixtures is infinite, of course. We also lack a lot of knowledge about the toxicity of the mixtures, so we cannot, since the high number of mixtures, it's not feasible to test them in toxicological tests. And some people have claimed we only need to worry about the risk drivers, and those are the chemicals that contribute, the chemicals in a mixture that contribute mostly to risk. But we usually don't know what are the risk drivers, and they will also be different for every mixture that we look at. So we can easily conclude that lack of such essential data makes it impossible to actually assess the risks of all relevant chemical mixtures. It's just not feasible. We can, of course, claim we can do research and we can add new test requirements to the system, but that's also controversial. So we don't see a clear solution to this information gap in the near future. And that's why the mixture risk assessment factor has been discussed. So what is it? Well, it's a very simple exercise where the regulatory safe exposure levels for a single substance are divided by a factor called the MAF. So it's mathematically very simple and it's a pragmatic approach. You can think about it as a risk cup. In the current system, every single chemical is allowed to be emitted up to the point where we are expecting effects from that individual chemical. So in the cup metaphor, this would be the cup to the in the middle. So we are allowed to fill the risk cup all the way up. If exposure exceeds the safe level, so the cup to the right that is overflowing, then we think there is a risk. And of course, if the exposure or the emission is below what we think is safe, then there is no risk. What the MAF does is that it moves these allowed emissions from filling the cup to only filling a part of the cup. And how much of the cup can be filled depends on the size of the MAF. So if a MAF would be 10, then the cup will be allowed to be filled to up to 10%. This is then to take into account that there are more than one chemical in the system. So allowing to fill the cup only to 10% would give room, metaphorically, for other chemicals to coexist in the environment, and thereby taking into account the combined exposures and cumulative effects. As I said, this is very pragmatic and mathematically very simple, but similar assessment factors are already in place in the system today, so it's not controversial in that sense. And those assessment factors are also pragmatic, but have been proven useful and are indeed not controversial currently. So why do we think a mixture assessment factor is a good solution? Yeah, I've talked a little bit about it already, because testing all possible mixture is not feasible, so we need a more pragmatic approach. The model concentration addition is strongly supported by a lot of science. A MAF can be applied already within the current system for individual chemicals, so it does not mean any revolutionary changes into the current system. It will immediately make regulation more realistic by taking these co-exposures into account. The current system more or less assumes that every chemical is emitted into a pristine environment, or that it has its own little piece of the environment where it's allowed to pollute without any other chemical present there. So that's the totally unrealistic assumption that we want to move away from. And of course, it will immediately, when implemented, reduce overall risks with chemicals, dealing with the problems that we saw in humans and the planetary boundaries. So $1 million question is, of course, what is the appropriate size of the MAF? And the size of the MAF rests on knowledge about the number of chemicals in the mixture, their respective potency or toxicities, and their concentration ratios in mixtures that coexist in a place and at the same time, and that contributes to an adverse effect or outcome. And as I indicated before, we don't know that. There has been a number of case studies looking at different actual real-life mixtures, and suggestions for the size of the MAF ranges from like 4 up to at least 500. Maybe there might be different estimations that I haven't seen, but it's a quite wide range anyway. And the fact is that it's, of course, very difficult to quantify, and there will be different results for different kinds of mixtures. What would be the consequences of introducing a MAF? Yeah, it depends on the risk ratios of the chemicals that are affected by a MAF. So chemicals where the risk cap is full or almost full, meaning that a risk ratio very close to 1 will be most affected. And in general, that would be plant protection products. The Swedish Chemical Agency estimated that about half of the active ingredients in plant protection products would be severely affected by a MAF of 10. But now, what is up now is the REACH revision, and it's very different for REACH chemicals, and the impact is likely to be significantly less for REACH chemicals. But on the other hand, it's more difficult to quantify, because REACH chemicals only have to show that the cup is not overflowing, and then if the risk ratio is 1 or less than 1, no refinements of the risk assessment needs to be done. So but we think that the effect would be much less, and at least for REACH chemicals. Introducing a MAF in REACH is proposed in the EU's Chemical Strategy for Sustainability that was presented in 2020, and that is under the previous Commission. And a draft of this proposal was prepared and presented to the Caracal, which is the European Commission's expert group for implementing the REACH and the CLP. And according to that draft proposal, a MAF of 5 was anticipated or suggested, and the application limited to high volume chemicals in REACH, and also with some possible exceptions where a more detailed risk assessment could be done. And it was also anticipated that in the next step, this would be extended also to other legislation. So indeed, the Commission has already prepared a proposal to introduce a MAF in REACH, which I think is very promising. So in summary, the science is very, very clear. Current regulatory approaches systematically underestimate real-world risk by not taking mixtures into account. a mixture assessment factor is a pragmatic way to relatively easy address a very complex problem. And by recognizing the effects of cumulative exposures and effects, introducing a MAF would make the regulations more realistic. And it's important to understand that MAF is no different from other assessment factors. So conceptually, it's no different from approaches that are already in use in the system today. And it's also relatively easy to integrate a new assessment factor into the current system. The Commission suggested a MAF of 5, and evidence suggests that that's probably too low. We don't know the exact number. It could be potentially as high as 500, but in my view, my personal view is that adopting a MAF of 5 would be still an important and very good step in the right direction. So I strongly support that. And I really hope that the Commission takes this opportunity now with the upcoming REACH revision to seal this huge loophole in the regulation and make it more realistic, and also in that way also more protective for human health and the environment. And with that, I thank you, and I'm happy to take any questions or comments.
Okay, thank you, Christina, for this very informative presentation on where we are with the MAF in the European Union. So I have one question that asks if you think that a MAF of 100 for a well-studied chemical brings its hazard level down anywhere near the lowest LOAEL that chemical has. And, given that well, this is getting quite complicated, the rest of this. So it says invertebrate findings are published every day with not a single dose finding. Some academics and registrations are used in any DNEL. So basically the question is, would a MAF of 100 for a well-studied chemical bring it down to a level that possibly could be low safe level?
Yeah, but MAF is simple mathematics. So what the effect a MAF would have on the regulation or restriction of a chemical depends on the risk ratio. So the risk ratio is when you compare a safe level or an estimated safe level of a chemical, like a concentration that you think is safe to be exposed to, whether it's a human or a rat or a fish or whatever, a safe level, and then you look at the exposure. So right now the exposure is allowed to go all the way up to the safe level, but not higher. So if it's the same, that's the equivalent to the risk cup being full but not overflowing. So that's what I see. It assumes that the chemical can have its own little environment where it's allowed to pollute all the way up to where effects are starting to be seen. So as I said, the MAF will just lower that allowed emissions and lower that allowed risk ratio, meaning that there will be room in this risk cup for other chemicals to be there. So the effect of an individual chemical would depend on the risk ratio, whether it's very close to 1, it will be more affected regardless of the size of the MAF. And it's also, of course, the size of the MAF. So it depends. For many REACH chemicals, they are well below 1. So if you have a risk ratio, given the data that you have, of 0.1, so the expected exposure is well below the safe levels, then it will not be affected by a MAF of 10 because you're already down there.
I get it.
So it's really up to the data situation and, of course, the size of the MAF, what the effects would be.
Okay, thank you for explaining that. I have another question about if, do you think there would be different MAFs for different population groups, depending on the level of exposure to vulnerability?
This is the discussion about how much we should go from one size fits all to having different types of MAF and different sizes of MAF. Me personally, I would advocate a one size fit all MAF because the problem is so complex. It doesn't get more easy just because we involve vulnerable populations, for instance, because we're all exposed. So I think we can embrace, in my view, we can embrace the pragmatic and simplistic approach of a one-size-fits-all MAF, because we are dealing with problems that it's very difficult to manage in a detailed way. And the whole idea is that we are in a risky situation and we want to bring those risks down. And then I think it's okay and also favorable with a very pragmatic and simple approach, if you like, because that's also very transparent to do it in that way.
Okay, thank you. Another question. Questions are rolling in here, so we have a few more. Are there any other known interactions other than additivity that might underestimate or overestimate a MAF?
Yeah, that is a very good question, because the model of concentration addition is very simple, that the exposures and the effects add up to each other. It does not take into account if we have synergistic or antagonistic effects. So it will totally overlook synergies and antagonisms. So in that way, a concentration addition can both overestimate and underestimate mixture risks. But what we have seen in the science for the past 25 years is that synergies and antagonisms are exceptions rather than the rule. Mm-hmm. So in the majority of cases, the concentration addition is working well. And the only way to identify synergies and antagonisms is to actually test the mixture. And for regulatory purposes, that will not be feasible. Of course, we can do that in individual cases, and the producers can, of course, do that if they like, but to have that as a rule is very difficult.
Okay, thank you. So I have another question about how you might think the MAF could be applied in human epidemiological research, and how could this be considered in statistical models, for example?
No, I don't think the MAF is made for epidemiological research. Mm-hmm. Of course, epidemiological data can contribute to information to a risk ratio, but otherwise, I don't know how to use it in research. And you can, of course, use epidemiology to evaluate different sizes, different mixtures, and it can give you some information on the size of the MAF. But I don't think the other way around, that the MAF should influence epidemiological study. A MAF is about bringing down the safe levels and make the regulatory system more realistic, taking mixtures into account.
Okay, thank you. Now I think I have time for one last question. We're running a little, or maybe another one, but how would REACH, if you would be able to tell us how REACH would plan to address PFAS when they're in gaseous form, like essential uses for some F gases or refrigerants? And, how might that work? Yeah.
I do hope that the Commission concludes on a very broad ban of PFAS, and that they will be severely restricted, because PFAS is clearly not sustainable type of chemical, and we have known this since the 1960s, and we now see very high levels of PFAS in our water and in our food. So I don't think MAF is appropriate. Of course, we will use the MAF. If it's introduced, it will affect allowed PFAS as well. But I think the preferred regulatory approach to PFAS is to ban as many as possible before our water is polluted to a level where we can't use it, and they will stay on forever. So I think this is a true disaster happening, and I very strongly hope that the Commission and other parts of the world takes this seriously and put an end to it.
Very good. I mean, it's a lot of information going on PFAS, and I was at a conference the other day where the European water industry was very concerned about the amount of PFAS in the water right now and how that could actually be cleaned up, and very much advocating for a rapid restriction of PFAS in the European Union.
Yeah, cleaning up would be very, very costly, and health effects could be also extremely costly.
Yeah. So I think I have one last question, okay, if you have time. Is it should the chemicals need to have a similar mode of action to be included in the MAF calculations?
Yeah, this has been changed over time, I think. So it has been broadened really. From the beginning, we talked about the same mode of action, and then it was like contributing to the same endpoint or affecting the same organ. I think scientifically, the development is that it gets more broader, from being very narrow to basically involving different types of toxicity. So I sometimes see it affecting the same organ, and sometimes I see it's even more flexible than that, because if you have chemical insults to different organs in your body, it would still add up in your body, so to speak. So you will feel it can affect you, even though the effects are quite dissimilar.
Okay. Well, thank you very much for already the presentation and giving your expertise in these questions and answers, and also encouraging people in the audience to, if you are working on this issue outside of the EU or in the EU, I'm sure Christina will be very interested in hearing from you. I just want to, thank you for your time and really appreciate what you've been able to share with us. And also for people who want to follow what's happening with the REACH revision and the MAF, I think we'll have plenty to be looking at in the coming months. So thank you, Christina, and I will give the floor back over to Alicia from CHE to close our webinar.
Thank you, Janan, and thank you so much, Dr. Rudén, for sharing this important work. Thanks also to all our participants for your thoughtful comments and questions. I'll wrap up now with some quick announcements. A video recording will be available on CHE's website soon, and you'll all receive an email with a link to the video. We encourage you to support the work of the EDC Strategies Partnership. You'll find links to each member group on CHE's partnership page. If you appreciate these webinars, please consider a tax-deductible donation to CHE and/or any of these partners. Please also join us on October 14th for our webinar, Toxic Docs, a database of once secret chemical industry documents. We'll share that link in the chat now. At the end of the webinar, you'll be directed to a Google form. If you like to provide any feedback, we'll put that link into the chat now as well. With that, we'd like to thank you again for joining us. Thanks again to Dr. Rudén for taking the time to talk with us today, and Janan for moderating this webinar. And thanks to Rachel Massey and Kristen Schaefer for their help behind the scenes. We hope to see you all again on future webinars.